Kwabena, I'm looking at the camera, right?
Yes, you want to look at the camera as opposed to at your screen.
Yeah, so I just want to, because I'm gonna do some of the introduction off the screen, so I just want to make sure it looks like I'm looking at the camera.
But am I looking? Am I looking at the camera?
Yes, you are.
You are, okay.
Okay, the social media places are working. It's 6:30 and 38 seconds now, so I'm going to start social media.
Okay.
So Uzo, are we live?
We are in 1 second.
Okay, well, I just wanted to say we want to gear a little bit towards Africa. That's what they said Femi wants.
Right. Okay. So, yeah.
Okay, we're going to be live in about 5 seconds. Stand by. I'm going to mute my mic now. Sorry. Oh, that's not where it is.
Hi, everyone. So welcome to the Africa Center Online, or the Africa Center Digital. I think we might be having a little bit of technical difficulty in terms of whether you guys can see me, but they're just working on that really quickly. Do we have an image? Okay. So until you guys can see me, I'm just getting reports that I am not on screen, but no matter, we'll get going like this, because I think you can see our very special guest today, Dr. Njide Udochi. Welcome.
Thank you.
Before we get started, and before I give Dr. Udochi a proper introduction, I just want to first welcome everybody to the Africa Center Digital. As you all know, this is a really trying time for everyone around the world in the midst of this COVID-19 pandemic. And as a result, many cultural institutions, many different groups have had to take their activities out of the physical spaces that we have. Ours is on 5th Avenue at 110th Street here in New York City. And we've had to go online and do some digital programming. And it's, not the same feeling as being in the same room with everybody and congregating together, but all the same, we can share and build our communities this way and make sure that we keep in touch and check in on how everyone is doing, and let people know that we're here and we're here together in the midst of this trying time. So I welcome everyone to the Africa Center Online. And as much as it is a trying time, I want to remind everybody that today is also World Health Day. And so today we celebrate the healthcare workers, specifically this year, nurses and midwives who are on the front lines dealing with our healthcare issues every single day. And so it's also fitting that we then have Dr. Udochi, who is a a specialist in many things, who's here with us to talk about and give us some information about COVID-19, the epidemic, and what we can do in the midst of this trying time. I want to let everybody know before I introduce her that this is a health information program. It's not specific medical advice. For specific medical advice, you should see your primary physician or your healthcare practitioner. But what we want to do today on this conversation is just give people an overview of the epidemic and what you can do in the midst of it to be safe and healthy. And so with that said, I'm going to now introduce Dr. Udochi, who's speaking to us from the Baltimore area. Is that right?
Columbia, Maryland.
Columbia, Maryland.
Mm-hmm.
Welcome, welcome. So Dr. Udochi obtained her medical degree from the College of Medicine at University of Nigeria in 1998. And she's certified by the American Board of Family Practice and the American Board of Disability Analysts. She completed her internship and residency at the George Washington University / Holy Cross Family Practice Residency Program. And she also completed a fellowship in geriatrics at the George Washington University Medical Center. She's currently the Chief Executive Officer and Chief Medical Officer of Millennium Family Practice down in Columbia, Maryland. But before that, she'd worked at the Mercy Medical Center and served as the Medical Director for Healthcare for the Homeless in Baltimore City. She's a certified specialist in HIV medicine and has experience in addiction medicine, as well as being a fellow of the American Academy of Family Physicians and having a master's in public health from the Johns Hopkins School of Public Health. So with that said, I want to just welcome Dr. Njide Udochi and say thank you very much for taking time out of what I know is a really busy period in your life right now as you deal with the COVID-19 epidemic on the front lines.
I'm very glad to be here to speak to you and everybody else about the pandemic.
So let's get started right away, and I'm just going to jump in because I think there are a lot of questions about this pandemic and this virus, the coronavirus that's at the center of it. So what is COVID-19? What is the coronavirus, and what exactly are we experiencing here right now?
So the coronavirus or COVID-19 is actually specified specifically. You can say it's coronavirus disease, which was found in Wuhan, China. It started off in China, in the Wuhan province, and that's why it got the name COVID-19 in 2019, around the fall of 2019. But the name that the proper name for it is SARS, S-A-R-S, CoV-2, which is severe acute respiratory syndrome, coronavirus 2. That's the proper name for this disease. So this disease started off in China and has now spread around the world. It's global, and we all know what has been happening here in the United States, where we now have many people infected with the disease and experiencing symptoms. So the symptoms that you have mirror what you have with the flu. So a lot of people who present with this illness and with the coronavirus disease are coming up with symptoms like fever, very common cough, sore throat, sometimes headaches, and shortness of breath. These are some of the common symptoms that you have. We also have noticed more recently that people lose their sense of smell, is what we call anosmia, and some atypical symptoms. We've had patients who present with stomach problems such as abdominal pain, diarrhea, as well as more commonly people who have like muscle aches, like you would have when you have malaria in African countries or the flu here.
Right. So this is an illness that kind of masquerades as many other things we have seen. As somebody who has had the virus COVID and has recovered from it, I can say that sense of smell, the loss of the sense of smell. I think I had it very mildly, but the loss of the sense of smell is a very weird one. And since you're saying it acts a lot like the flu, or it might just be that somebody has a loss of a sense of smell or some nausea. how are we figuring out who has this virus, and what it's doing to people?
So right now, the easiest way to figure out if you have the virus is when you have these symptoms. Because it's a pandemic, we assume that if you're having a fever and having a cough, sore throat, and muscle aches, headaches at this time, that is probably coronavirus.
But that's changed, because I think initially they were saying that that wasn't the case.
Yes. Initially, I mean, one of the things that I want everyone to know is that over the months, this is a brand new disease to us. And I think that it's really frustrating to a lot of people, because we keep having guidelines that change from the CDC, and you hear from your health practitioners that there's a new guideline, and you also have new recommendations that you have to follow. And that's because it's a new disease to us, and we're learning as we go. So I just want everyone to know that as we learn more about the disease, we're going to be making changes, and recommendations may change. And so I think that because of the changing recommendations, a lot of people are getting really worried and thinking that maybe there's some conspiracy around some of the recommendations that have been put forth. But we're looking at the experiences of the Chinese who started out with this disease, as well as in Europe, where in Italy and France and the United Kingdom. So, and we're building up on and trying to learn from the experiences of these different countries and coming up with recommendations. We're also looking to the WHO, who is closely monitoring this disease all over the world, as well as the CDC, where our scientists are monitoring this disease very closely. As we discover new things, you may find that the recommendations that you had a month ago may change. But and I'm really appealing to everyone to please follow those guidelines and really, really closely pay attention to the recommendations, because it will make for us to be able to manage this disease better, as well as diminish the spread of the disease in the community.
Right. So let's go back to some of these signs, because I think you said now we're looking at if you have a fever. What exactly is a fever? How do people know when they have a fever?
So a lot of times you feel your body is warm, it's hot. You feel feverish. You just don't feel you might have muscle aches. You might start sweating, having chills. Those are some of the symptoms that you experience when you're having a fever. And I know a lot of people have thermometers. They're able to check their temperatures. Usually your temperature will be above 100.5. And so when you have this, you pretty much right now, because of the pandemic, we assume that you probably have coronavirus, because we already have community spread all over the United States. So that's when we're thinking that you probably have the disease. We also have to be careful, because we're already in allergy season, and because this disease also mirrors other kind of diseases like the common cold. But when you have the common cold, most people don't have very high fevers, and most people are not having difficulty breathing. So if you have allergies, you might have some itchy nose, itchy eyes to go with it. You don't usually have fever. So those are some of the symptoms that we as clinicians look to differentiate it from other diseases. Specifically, when we want to, go ahead.
Oh no, I was saying, so these are some of the things that you look at. So, but I cut you off. You were saying specifically.
Specifically, when we want to find out if you have the disease, we have testing that is available. The problem that we have is that because we have limited resources, the CDC has developed guidelines as to where, who gets tested in what jurisdiction. So different states have different recommendations. For instance, the CDC is recommending that healthcare workers and people in the hospital be given priority, because we don't have enough testing kits in the whole country to test everyone. So when you have a symptom, if you start having symptoms like fever, and you have a sore throat and cough, or you feel short of breath and you're wondering whether you have the disease, the best thing to do is probably to call your primary care doctor. Call your doctor or call your clinician, your nurse practitioner that you see, and tell them about what you're experiencing and get guidance from them as to what to do.
Right. So now you've been practicing medicine for 30 years now, or just a little bit over 30 years. And have you seen anything like this in the time that you have been practicing clinical medicine or also studying public health?
No, I have to say that this disease, beats all of them. And the reason why we're very worried about this disease, and I think the reason why a lot of clinicians are extremely worried about the disease, is that it's so easily transmissible. That means that it can spread. And a lot of times people who have the disease don't even know they have the disease. And there are many people who are asymptomatic. That means they're not actually having any symptoms and they're transmitting the disease to other people. Also, because of the fatality rate, if you look at the fatality rate of something like the flu in the United States, it's 0.1%. Whereas the fatality rate of the coronavirus it's high, 3.4%. I mean, it's gone as high as 10% in Italy, and overall, 10%. Yeah, and here in the United States, we're still trying to calculate what it is because our own pandemic is evolving every day. But overall, the WHO says it's about 3.5%. Right. Of the fatality rate. That means it's about 35 times more fatal than the flu. So wow. That's another reason why a lot of physicians and clinicians are very worried about this disease. We're also very worried because we don't have a vaccine for this virus. And we don't have any treatment. What we have is we've been trying different protocols and different medications to see whether they will work to manage the disease. So I
want to because I want to talk to you about treatment and protocols, because I know that has the fact that there is no treatment yet has a lot of people very anxious. And I also know that we've heard different numbers about how long it will take to develop a vaccine. But before we get to that question, I want to ask, so who is most at risk for getting this current COVID-19?
So that is a very good question. The people who are at risk really are people who have underlying medical conditions. And one of the things I wanted to do today is to really take the focus out of the number of people who are dying from the disease to really focusing on the number of people who have recovered or people who have this disease and actually do well. The disease, nobody wants to have coronavirus. But I will tell you that in my experience and with the patients that I've had in my practice, about 80% of the people who have tested positive for this disease have mild to moderate symptoms. That means that they may have, like Uzo, the kind of symptoms that you had. Mild symptoms, a headache, they might have fever, and they may experience a cough, but they are able to beat this disease. So about 80% will have mild to moderate disease. So it's only about 20% who develop the symptoms that are really life-threatening, difficulty breathing, and having what we call hypoxia, not being able to really get enough oxygen into themselves. Those are the patients that end up in the hospital and end up on ventilators. So I want to reassure everyone that most people will actually beat this disease, the viral illness. So it's really important for people to know that, and to know that you can actually recover from this disease.
So most people's bodies actually have what it takes to be able to clear this virus.
A lot of people have what it takes to clear this virus. So back to the question of who is most vulnerable. The reason why we're very worried about this is because of how transmissible this disease is and what it does to people who are more vulnerable. So the people who are more vulnerable are people who have underlying medical conditions, such as diabetes, high blood pressure, asthma, any lung disease, people who are immunocompromised. So people living with HIV and AIDS, and people with immunodeficiency syndromes. So what that means is, unfortunately, if you look at health disparities in the United States, you see that a lot of people of color, tend to have a lot of morbidity. And what I mean by that is they have a lot more medical problems. And a lot of them, then when they're exposed to the coronavirus, they tend to be sicker than other people in the country. So that's why we're seeing a skewed morbidity in New York and other parts of the United States, where people of low income tend to seem to have a lot more disease.
Right. So I think you brought up something that urban areas, I was just reading earlier today that cities like Detroit have been showing quite a large discrepancy actually in the number of people who are dying for the disease in terms of race, that Black people, as you said, people of color tend to be more effective. New York City, if you look at the zip code maps, you find that areas that are more heavily minority in this city tend to have more people dying from the epidemic. So really this then calls into question, is this also a disease of sort of health disparities, not just a clinical disease?
And again, it brings us back to the fact that, here in the United States, people of color don't have a lot of access to good health care. And they have a lot of people of color, their medical symptoms tend to be minimized. There's what we call provider bias a lot of times. So many people tend not to seek help at the right time. A lot of times they're trying to take care of it and they have other pressing problems. So they might have multiple medical problems, but they're not able to get their medications on time because they're trying to work 2 or 3 jobs to make ends meet. And so they're not keeping on top of their health care. So this disease will disproportionately affect those who have a lot of underlying medical problems. We've seen that when we look at patients who are not doing well from the disease in the hospital, they tend to be the patients who have more medical issues. Here in Maryland, we also see that younger patients who have been exposed to tobacco, smoking, vaping, also tend not to do well. So there are things that we're seeing, behaviors and underlying medical conditions that people may have. The elderly who are more prone to having more serious disease because their immunity is not as good, tend not to do well also. So that's why we're encouraging people to, try to stay away from people who are elderly or people who have multiple medical problems. And we're also trying to encourage people who have medical problems, especially minorities, to make sure you're taking your medicines. Make sure that you're calling your doctor if you're diabetic, that you have your medication that you're taking and you're on top of it. If you have asthma, that you're using your medicines as prescribed, so that you don't have an uncontrolled diabetes or uncontrolled high blood pressure on top of getting this disease. But so your immune system is much, much, better, once you're stable and taking your medications.
So I just want to emphasize that point, that really being in touch with your primary healthcare providers is one of the keys to good health in the midst of this epidemic.
Yes, that's extremely important. A lot of times people have asked me, what can I do? A lot of people feel powerless about what is happening now. There's a lot of anxiety because if you look at the television and on social media platforms, you're seeing that, a lot more people, the next 2 weeks are predicted to be really bad. What can I do now? What you can do now, and I want to encourage everyone and let you all know that you can do something. You actually have a lot of power. What you can do is look at yourself. If you have a medical problem, please take your medications, contact your primary care doctor now. We're doing a lot of telemedicine now. So contact them, get your prescriptions, take them. Then there are other things you can do. You can also exercise. There are ways to boost your immunity. Eating healthy. And here I go to a lot of, I'm from Nigeria originally. So, we cook all our food, so from scratch. So eating healthy is really important. All those soups, the egusi soup, jollof rice, this is the time to eat, and eating fruits and vegetables is really, really important at this time. So eating healthy is really important. Exercising is very important also. Right. Taking that time to exercise. These are things you can do to boost your immunity, and make yourself feel better. Also limiting your exposure to the television, because once you look at it, there's a lot of anxiety because what is being portrayed there is only negative news, they're bringing up the bad news. So there are some things you can do to help yourself and boost your immunity.
Right. We have a couple of questions coming in from Facebook, which I'll ask in a second, but you mentioned something about minority communities or people of color being most affected here in the United States. But let's turn our attention to Africa for a second, because the numbers that we're seeing on the continent of people who are affected look very different from the numbers that we're seeing in other parts of the world. So I just wanted to ask your thoughts. What are we to make of the epidemic on the continent of Africa, in countries like Nigeria, like Kenya, like South Africa? What's really happening over there?
Oh, yes, Uzo, that's a very good question. It's very puzzling. This is a new disease, and we're learning every day, as we go along. We are very, very surprised, and pleasantly so, that only about 10,000 cases of coronavirus is on the continent of Africa, the whole of Africa, 10,000 cases. And we've had only about 490 deaths in the continent. So what we are looking at is, we're wondering whether this is a different type, the disease is presenting differently and is less virulent in Africa as compared to the Western countries and the United States. And we're also looking...
So it's either less virulent, but what about the reporting? So is it that maybe we're not reporting in the same way or testing? Is it one of those?
Well, of course, that a lot of the African countries lack the infrastructure, and funds to be able to do what we're doing here in the United States or our different parts of the Western world. However, even when you put that in, if you look at that, we're still seeing that even when people get sick there, it's milder. It's more like having a milder disease, more like the flu. Like the cold, the common cold, or like a mild flu. People get exposed to it and then they recover very quickly. We're not seeing a lot of people who are ending up dying. The fatality rate in Africa is much less, compared to the Western world. Even when we account for this, we are holding our breath and wondering why. But we're looking at different reasons, and we're looking forward there. I know that there are a lot of scientists out there trying to figure out why. For instance, we're wondering, because there's been a lot of emphasis on hydroxychloroquine and chloroquine. And we know that in the malaria belt, in sub-Saharan Africa, where people are exposed to malaria and have been receiving chloroquine for over the years, including myself, I've had malaria and been treated with chloroquine, that people in the malaria belt and in sub-Saharan Africa seem not to be as sick as others in different parts of the world. So we're looking into all that to see, and the scientists are trying to determine why. We don't know, but we're learning and we're looking at that to see maybe that's a reason why there's some innate immunity that has been built up over the years. And we're hoping that that's what it is. We're not sure, but we're hoping because, this disease is very, very virulent. And if that's not the case, then where African countries are really in for a lot of trouble.
How, really quickly, I think for folks who don't really know, we've heard a lot about different kinds of treatment or experimental treatments. You just mentioned chloroquine, hydroxychloroquine. Can you tell us a little bit about one specifically, what is hydroxychloroquine? I know that President Trump has mentioned it. There have been a couple of studies in France and also coming out of China that say that hydroxychloroquine might be effective or one kind of treatment. But where do we really sit with treatments for this particular disease?
Okay, so I want everyone to know that really there is no treatment for coronavirus disease. We don't have a treatment yet. So we haven't done the studies and come up with a treatment that has been shown to be effective to help treat this disease. However, we know that there was a study in France and another small study in China that used chloroquine, which a lot of African physicians and a lot of Africans are familiar with, as well as hydroxychloroquine, in addition to azithromycin, which is commonly known here in the United States as Z-Pak, to manage patients with the coronavirus. And those two small studies showed that some of the patients seem to do better. Now, because of that anecdotal evidence, a lot of physicians in different parts of the world started trying to use hydroxychloroquine and chloroquine on a compassionate basis. Here, the FDA has just approved it to be used on a compassionate basis in the hospitals in New York. And there are trials ongoing now to see whether it actually really works. So because of that, those two small studies, people have started using it. And a lot of the physicians are reporting that what they are seeing is that when it's used early, with mild to moderate disease, that the patients seem to do better and not progress to being to becoming sicker and ending up in the hospital. But again, we need to do a study because we don't know, well, would these patients have recovered without the treatment? So that's where the controversy is. But because we're in the middle of a pandemic and we know that a lot of people may end up really sick, we're trying to use this medicine. So hydroxychloroquine or Plaquenil is what we use a lot to treat illnesses like lupus here in the United States. Chloroquine has been used to treat malaria in Africa for several decades. And these two medications, in combination with azithromycin, which is an antibiotic, because we know that the coronavirus does induce some kind of pneumonia. So used in combination, and then adding some zinc to it also seems to help some patients. But I want to warn you that it's not, going out to use these two medicines. You have to make sure that you're talking to a doctor and that you have to know that this is experimental, because those two medications in combination may actually cause what we call cardiac arrhythmias. They may make your heart beat differently, and it can sometimes kill. So that's why we're looking at the risks and benefits of using the medications together. And if you all know, when we use chloroquine to treat malaria, we don't actually add an antibiotic to it. So when people say, oh yeah, but we've known chloroquine, but that's not the combination. Here we're using it with an antibiotic that can actually cause some heart problems. So that's why we're actually scientists here, and Anthony Fauci is saying, no, let's do the proper studies and make sure that this protocol actually works.
Anthony Fauci being the head of the National Institutes for health or
allergy and infectious diseases.
Allergy. I wanted to pause for a second. I don't know if you could hear that behind me. That's here in New York City at around 7 p.m. There's this tradition now of cheering healthcare workers who are coming, and essential workers really. But I just wanted to take a moment, since it is just around 7 o'clock, to say thank you to you and to all the other healthcare workers around the world who are putting their lives on the line and working really hard to make sure that the rest of us can stay healthy. So thank you very much.
You're welcome.
We have some questions coming in. So I wanted to just quickly turn, on this idea of the treatment and trials. We have a question from Tinashe Gongora, who is asking from in Australia and a few other countries, they've started clinical trials using the BCG vaccine for health professionals. And I think the question is about, what is that BCG vaccine and what is its relation to COVID-19? And are there any other programs to protect health professionals on the front lines?
Okay, well, thank you for that question. I think that researchers started looking at the BCG vaccinations when the scientists and researchers in Italy were seeing that the African immigrants in Italy did seem to have a milder disease. And they were postulating that perhaps it was because they actually had the BCG vaccine. That's why the illness did not seem to affect them as much and was not as virulent when compared to other Italians who had not had the vaccine. So that's another, it's another way of looking at it and trying to see, since we don't know much about this disease, what is it that is giving someone some immunity, some protection? The BCG vaccine is what we use for TB prevention, which is usually given when a child is born in a lot of developing countries, including Nigeria. So that's why a lot of the immigrants that were there were African descent, and they seem not to have seem to have milder disease when compared to other people in Italy and at this time during the coronavirus pandemic. So that's why probably the Australians are doing a trial using that to protect healthcare workers. What was the other question? What other?
And what other things are people doing to look at protecting healthcare workers?
Well, I mean, right now, we're focusing more on PPEs, using the protective, protection. As far as medications, we haven't come up with prophylaxis yet for health workers.
Prophylaxis being
medications that we can give health workers to prevent them from actually having the disease. I know there are trials that are going on now, and a lot of studies going on to try and figure out what can you do and what can you give health workers to protect them. But we don't have anything yet.
Okay. So another question that has come up, and I think it kind of follows on this idea, what you were just talking about, African and African immigrants in Italy being less affected or less sick, is that there are a lot of conspiracy theories that are circulating around Black communities about immunity of Black people or not being as affected, and that might affect the way that people behave around the disease. And can you address some of those and speak about what we can do to provide the correct health information?
I think that one of the things that we can do is actually doing forums like this. Having these discussions are really, really important for the African community, because I know that over the past couple of weeks, there have been a lot of conspiracy theories. I remember the 5G, which is all nonsense.
Can you tell us a little bit more about that 5G conspiracy theory?
So there's a conspiracy theory about using the 5G. The coronavirus can be transmitted when you have a device that has 5G. There's also been some theory about, the 5G, what do you call them? The
towers.
The towers transmitting, coronavirus. All those conspiracy theories have no founding in science. They are none of that is true. So it's really important that leaders in our community speak out about what is the true way that coronavirus is transmitted, and also to speak to our different communities here, whether it's at home in Africa, in different countries, or here in the United States, so that we know that this disease can affect Africans. It can affect Africans, and we need to follow the guidelines that are already out there. Do social distancing, wash our hands, use the face masks when you go outside. All these measures help, decrease the spread, and also help the healthcare workers that are out there working, because then the less people who are infected and affected, the easier it is to actually contain the disease and manage the pandemic.
So guys, we're getting a lot of good questions coming in off of Facebook, and I think also off of Instagram. I just want to let you know that now is the time to start sending those questions in. If you have questions for Dr. Udochi, send them in, and we'll get them over here so we can ask her directly and she can answer them. Dr. Udochi, a couple more questions have come in. I think you started talking about it. This, excuse me, this idea of social distancing and also face masks. Now, there have been, I think, a change in the official stance, which is, excuse me, I need a little water. It's a good thing we're doing this on the screen. That way I'm socially distant. I can't cough onto
anything. Yeah, that's right.
So I think there have been some changes in terms of what we should be doing with wearing masks outside. And then we have another question that's come in that asks, some people are still going to the park and hanging around outside. And this viewer wants to know, should we just stop going out altogether to stop this from spreading? How do we really practice social distancing? And how do we use masks or personal protective equipment to protect ourselves and others?
So I know a lot of people are frustrated because every other week, there are new guidelines that are being issued. But I want everyone, again, to reassure you all that, first of all, as we learn more and more about this disease and the way that it's spread, then there are going to be guidelines that are issued to help contain it. So initially, we're asked, only healthcare workers were wearing masks, specifically the N95 masks in the hospitals. And I'm sure a lot of you heard about that, because they were more in contact with patients who were coronavirus positive or COVID-19 positive. But now a new guideline was issued that you should wear some face covering. And the whole idea is because we just noticed in the past couple of weeks that with the community spread that a lot more people were getting the coronavirus disease, and scientists started wondering whether that it was airborne or, there were smaller particles that were being transmitted, when someone speaks forcefully, for instance. And so they started looking into it as a way of protecting, also looking at data from different countries where people had been wearing masks and looking at the
countries like China or South Korea.
South Korea, for example, and so learning from them, with this, the CDC decided to issue guidelines to just use masks just to protect yourself, from another person who may have the virus, So it's more, any mouth covering to help just create that form of barrier between you and somebody else. Right. And I don't want people to stay indoors all the time. What we are saying is because we want to encourage you to also exercise and go outdoors, but we don't want you to congregate. We don't want to, we're still learning more and more about this disease. And we find that when people congregate, even when people are asymptomatic, they might be transmitting it to another person who might go home and transmit it to a more vulnerable person. So, right. So that's the reason why we're talking about social distancing. So you can still go outside, just keep your distance, the 6 feet away from somebody else. Do not congregate together. You can go and run or take a walk outside. But, it's important that people obey these rules, because that social distancing is actually one way that has been proven to help contain the disease. And it looks like it's paying off.
Mm. I want to ask you now, because so you trained in Nigeria and then you emigrated to the United States and have been practicing here for the bulk of your career. And oftentimes, we have a lot of issues around there's a lot of talk about immigration and Africans and all these people from countries coming here who are not skilled or whatever. But you're a doctor, and a lot of healthcare professionals are a lot of Africans who come here are also healthcare professionals. I just wanted to ask your opinion on what you've seen and how people have responded to you, both in general as a doctor of African descent or African origin, and how that is affecting things now during the midst of this epidemic, where people have been saying, "Oh, it came from abroad. It came from abroad."
Well, I immigrated here, and I've been a physician here practicing over the past 30 years. It's been really a blessing to be in the community that I practice in, Howard County, Maryland, because there's so many immigrants in this community. There's people from all over the world here. In my practice, for example, I have patients who are from over 114 countries. So it's really a good place to work. But a lot of physicians in the United States are of immigrant background. And many of them are fighting now and helping in this pandemic. I have so many colleagues of mine who are working in the ICUs here in Maryland and are leading the fight against this coronavirus pandemic. So, immigrants play a very large role, a very important role in the United States and in our community here. And a lot of immigrants are very educated and very hardworking. A lot of the physicians that you see and even healthcare workers, if you look at the healthcare workers in most of the nursing homes all over the country, even in Washington State, when the pandemic started, a lot of them are of immigrant background. So immigrants contribute a lot to this country. My patient population here, they've been very, very supportive since this pandemic started. Everybody has really been calling to make sure that I'm okay. And they've been listening to my advice and the advice of a lot of my colleagues on what to do, and really calling us to be able to talk to us, to be able to also talk to people in their own groups. For instance, we have a lot of church groups here in Maryland And we've been able to speak to some of the pastors here, to speak to their congregation when they talk, and give sermon, to tell them to adhere to the social distancing and all the CDC recommendations, and to tell them that it actually is real, and not to listen to all the, different conspiracy theories that are out there in social media, so that we can save lives and help other people and help our communities.
Right.
It's also very important for us here, so that we can also transmit that information back to our own countries. I have a lot of physician colleagues who from different parts of Africa and even Asia, to be able to let them know what is going on here and how to manage, and to be able to lend a hand to the physicians who are practicing in our various countries, to help them, give them the data, help them with supplies, and give them information so that they can better manage the diseases back in our own home countries.
So I just want to pick up on that, because you have a very global set of colleagues. Your practice has been a very global one. What are some of the things that your physician colleagues or friends on the continent of Africa are telling you about what they're seeing right now?
Is it specifically in their own countries?
In their own countries, say Nigeria, your home country, our home country, I should say, but also around the continent.
Yeah, so a lot of my colleagues who are from different African countries are very, very worried. The reason is we're on the front line here. We're dealing with patients here. We see how the disease has been, really virulent in the United States. So they're very worried and are trying to make sure and contribute in whatever way they can to their own countries. So we know that a lot of the African countries don't have the resources or infrastructure to be able to mount the kind of defense that we're having here. Even here in the United States, look at all the problems we're having with PPEs, as well as trying to get medications and treatments for people, ventilators. Many African countries don't even have ventilators. Some of them have none. Nigeria, for instance, has under 500 ventilators for all its population. It's the most populous African country. So we know that we need to do other things. So I actually want to commend a lot of the African countries. Because of the Ebola crisis in 2014, countries like Nigeria started very early, to mount a lot of programs to better contain the virus on the continent. For instance, they stopped flights. Many countries stopped flights and implemented social distancing also. It's questionable now how that is working in different countries, but at least they're working really hard to try and make sure that anyone who tests positive gets treatment and is isolated from the rest of the healthcare community, so that they have resources directly targeted towards those patients, and they follow the patients and make sure that they can get whatever care they need. So they know that there are a lot of problems that we can have, and that this disease can really wipe out the continent. So a lot of the countries have been very, very, very progressive in trying to, screen people. I remember seeing one of my colleagues, who sent me something when he was leaving Ghana, and saying that the screening in Ghana was way better than the screening in the United States.
Really?
At the airport. Yes, because we know that if we can prevent the disease from spreading, that it's better to contain it rather than to treat it. So right. A lot of the African countries and a lot of the healthcare workers who are fighting the coronavirus disease on our continent are focusing more on containment. The presidents of those countries have decided that, look, we don't have the resources to be able to, really mount the kind of defense against this disease if it comes into our countries in such the same way as it has affected other Western countries, and have decided to focus on containment. So that's where they've really targeted their efforts, and I think it's paying off.
We have another question coming in from a young physician who you know quite well. His name is Dr. Chichi Udochi, your son, who is currently a first-year resident at George Washington University Hospital. We'll give a little shout out to Chichi, because I'm sure he's dealing with a lot of this right now as we speak. But he asked you, so there's a lot of talk about flattening the curve through social distancing and having people, reduce the number of cases there is right now. But he's asking a bit about, what about a resurgence of cases? Is there a possibility that cases could come back, that we could see more cases later on in the year, even if we flatten the curve? Well,
I mean, again, it's really important to also remember that this is a new disease, and we're learning. We continue to learn more as we go on and deal with this disease. So we've seen that social distancing has helped other countries actually flatten the curve. But we also have seen that in some of those countries, for instance, in Japan, that when the some of the social distancing conditions were lessened, that there was a resurgence of some cases, coming up. So we're wondering, and scientists are wondering whether, there could be another spike again. So it's something that we're still working on and still, trying to figure out what we're going to do and how we're better able to manage patients later on. But we're hoping that as more and more people have this disease, that it will behave like other viral illnesses and that you will have some immunity. A lot of times when you have a viral illness, you build up an immunity to it. And we're hoping that even if there's a resurgence, there'll be very few cases and we'll be better prepared. Number one, we'll have vaccines. Maybe we'll have, one of the trials will be done and we'll have medications that we can use to help manage patients. So we're hoping that as time goes on, that it will be better. It will be better it will be easier, I should say, to better manage the disease.
So let me ask you really quickly, because we're getting close to the end of our chat. Let's talk a bit about, you mentioned vaccines. Let's talk a bit about vaccines. What is a vaccine and how could it work in this particular pandemic?
So looking forward, one of the things that we really want, because of the fact that this disease is highly contagious, is trying to manage this disease by vaccinating people. Everybody, pretty much, if you're in the United States, you probably had a shot. That's what we call shots. When you go to a doctor's office as a child, you probably got the measles shot, or you got the tetanus shot, or you're going to college and you're told to get the meningitis shot. So vaccines are shots, I'm going to use shots that you get to help protect you, to build immunity against the disease. So the scientists here are working really hard to develop a vaccine. However, the vaccines are not done that quickly. It will take about 12 to 18 months to be able to get a vaccine that we can all have, and then use that vaccine to give immunity to individuals so that you don't contract this virus.
Right. So it will take about 12 to 18 months, we're thinking.
Yes, that's what we're thinking.
Right. So in that period of time, following all of these guidelines and making sure that we're keeping healthy, that we're social distancing, and that we are really taking into account what our physicians and some of the healthcare officials are telling us will be the most important thing for us to do.
Yes, and also hand washing. Remember that.
Hand washing. Wash your hands. Wash your hands.
I also want to tell people, please, it's really important that you empower yourself. It's very important that you take care of your health. This is the time to take charge of your own body, to say, how can I improve my health? Because if your immunity is good, remember I started off by saying that about 80% of people who have this disease actually have mild to moderate disease. So if your immunity is strong, you're going to be able, when you encounter this disease, to beat it. So what can you do? What you need to do now is take charge of your own health. Exercise, eat healthy. Go out, and if you have a medical problem, go to your doctor's office. Get that physical that you need, that you were delaying for many, many months. Do that. If you find out that you have high cholesterol or something, that you deal with it. You follow your doctor's advice and do the things that your doctor says, so that your body is strong and healthy. So those are the things that you can do to really empower yourself and help yourself. Educate your relatives. Let them know that it's really important for them to be on top of their health. Because we say health is wealth. If you're not healthy, you're not going to be able to enjoy, anything that you have. So it's really important that you take charge of your body at this time, and you do those and stop smoking, those habits that don't help you, like smoking, drinking. Those things, impact your immunity. And what you want to do now is build up your immunity. A lot of people have heard that, there are people who are more affected by the disease, people who have medical issues. So you don't want to do that. You want to be that person who is working really hard to stay healthy, to build up their immune system. So, and how can you do that? You can do that very easily by exercising, by eating healthy. sleeping, resting, very important. Those are the things that you can do. Going to your doctor, following the advice of your doctor when you examine, and doing those things that will help you stay healthy.
Thank you so much for that. I think on that note, what we're going to do is we're going to close out. I want to thank you tremendously, Dr. Udochie, for taking time out of what is a very busy period for you to speak with us and to educate us and our community about this epidemic, or I should say this pandemic and this disease, COVID-19. I also want to just reiterate to people that Dr. Udochie has been kind enough to give us some time and some wisdom here, but this is not medical advice. This is an informational discussion. And that, as she said, you should make sure that you communicate with your healthcare provider. If you have any symptoms, any direct questions about your own physical state right now during the midst of this pandemic. But Dr. Udochie, I just wanted to, before we end, just say thank you to you, thank you to all the healthcare workers who are out there risking their lives, spending all this energy to make sure that we are healthy and that we stay safe. And we hope that you also stay healthy and stay safe, and wish you all the best as you deal with this pandemic.
Thank you so much. Thank you, Uzo, for inviting me. I also want to thank everybody at the Africa Center for hosting this much needed discussion. It's very, very important that we reach out to the African community all over the United States and even, in different African countries, so that they know what is going on and that they listen to good advice and not follow conspiracy theories. Thank you.
Thank you so much. And so we'll let you get back to work, but we hope to see you again sometime soon.
Thank you.
Take care.
Are we up?
I think we are. I think they've ended it right now. So we are.
How did you do?
That was really amazing. Thank you so much.
Oh my God.
That was a really informative, and you're so good on screen. You should be doing all these different things. You should be on CNN and all these places instead of all these other people. That was so good.
Okay, thank you so much. Thank you.
That was also cool that Chichi sent a question.
I was so shocked that he sent in a question. And he sent in the hardest question.
Thank you so much. That was so wonderful.
Oh, thank you, Alana.
Thank you so much.
Yeah, thank you.
Thank you. We had some technical difficulties with Instagram. So it wasn't streaming on Instagram, but this is our first program, but Facebook looked beautiful. So you'll be able to see it on Facebook.
Okay, thank you.
Excellent.
So will I get it? Would you send it to me? Or
We'll make sure to send it to you.
Okay, thank you so much. And is it Kwabna? What's this?
Yeah, I'm here.
Oh, thank you, Kwabna.
Kwabna was stressed out doing the tech in the back.
In the background.
It's okay. Thank you. Well, thank you for inviting me.
Yeah, this was really, really good, and I think it's going to be really helpful for our community. So what we'll do is we'll probably also cut a couple of clips, I think, and maybe post some shorter versions of it so that you could send. Kwabna, we can do that, right? Where you maybe be able to put it on your Instagram or on your Facebook.
Yeah, that was
Okay, yeah. So we'll be doing that as well. So even if we didn't get it live on Instagram, that you can also send it out, and then we'll put it out on our Instagram as well.
Okay, thank you so much.
All right, and Tunjida, we'll let you get back. I know that you've taken quite a bit of time out of your day, but thank you so much.
Thank you so much.
Take care. Bye-bye.
Right,
okay, bye-bye.
Bye.
Alana?
Yeah?
Do you want to call me? Or can we have Femi, can you hop into the room, please?
Okay, I'm gonna disconnect Dr. Udochie then.
Okay, great.
Maybe you could. I'm have panic attacks about this live. I know I can't see it, but still.
Are we?
Or we have to stay live.
In order for us to continue talking through this platform, we have to stay live.
Okay.
But we're not streaming to any public place right now.
Okay. Then we can have our debrief now. Henon, are you still there too?
So who should I invite in? Remember, we can only have 4 people in.
Femi and Henon.
Henon can be. She doesn't have to be in. She can hear us, right? Henon, can you just confirm you can hear us? Okay, just bring Femi in. Let me call Henon, and I can debrief Henon as needed.
Okay. All right.
I'm here. Can y'all hear me?
Yeah.
We don't just dish celebrity news, we become celebrity news. Drew Barrymore, she's friends with
what is going on behind?
was like, you know, I think you should put
Let me turn the TV off. Hold on a second.
Can we turn it down? I'm gonna go outside. Can you turn the TV down a little bit? It's time to play.
How about you outside?
Hi.
Hi. That was great.
Party over there, Femi.
Family Feud nightly.
So how was our first digital program?
It looked so great.
Did it?
It did.
Cool.
Picture quality on
great.
Facebook was very good.
Was really good?
Yeah, definitely. Super HD.
Alana, you're on mute.
Sorry. I can't believe, No, I was saying it was really, really good. I was so impressed because on Instagram, and Instagram was going around and around and around, but Facebook was really great. And just like, looked really good. It looked really profesh.
Okay. That's good. So I guess we just need to work out the technical difficulty thing on Instagram. Do we know what that was?
No, and I was searching their support website to see what could have caused it. Because normally, even if you stream to Instagram for only a minute, it will still save that in your story.
Yeah.
And we streamed to Instagram for a couple minutes before it crashed, and it did not save anything in the story.
Oh, really?
Yeah, so I still can't figure out why it happened.
Did Jenny just send through how to look good on camera?
Who, me?
No, Jenny just sent something through.
Oh, Jenny?
Oh, wow. Okay, guys, this was really good. Kwabena, thank you so much for all your technical support and help.
So my pleasure. So I'll tell you one stupid thing I did at the beginning.
We have in the background, if we could.
Is that Femi's TV that we're hearing?
We've got Femi's TV in the background.
Yeah, I'm sorry. I'm gonna keep muting.
Oh no, I was supposed to give you the countdown to let you know when we started, but I was looking at my own Instagram because that's what we used during our test.
Oh, so you weren't looking at the Africa Center one?
Exactly. And then I was like, wait, why am I? And so that's what got tangled up at the beginning. But it was that, and then Instagram's crashed. Those are the only issues I had.
So Instagram was also acting crazy because it was just going around and around and around, and that's before it started. It locked out. What do you think the issue with that was, Kwabena?
Well, you know, that also points to the fact that Instagram was only showing Dr. Udochi's camera, and I am not sure what in the world was going on with that, but it seems the communication passing through Lula.tv is where the problem occurred.
Yeah.
So I mean, let's just see if we can go back through and sort out some of this stuff.
How did it feel for you, Uzo?
I mean, it was good. I mean, I now know what I need to do in terms of making sure that I have different screens in front of me so that I can see questions and whatnot. But I think it went well. I just, in terms of where to look and sort of like what the presentation was like, did it feel like it worked?
It did feel good. It did feel good. Just so you know, from the Africa Center Facebook, it says that we reached 378 people.
Nice. So,
and like
the most I saw at a time was like 20. So that's like kind of crazy. I think it counts every single person that joined, which is kind of good for our numbers.
Which is good.
Yeah, and it's going up by the minute. Like 5 minutes ago it was 246. Now it's 287, views. So it's just going to live there and people will continue to share it, as will we.
Excellent. So I think this is where now, I mean, this was a good test and a good way of reaching people. I think one of the things that we know to do is we can market a bit more beforehand, and market aggressively. And then second is, I think this is where the partnership with something like OK Africa comes in handy, because they will have additional viewership that they can, like that we can just tap into. And I think we should be really aggressive about stuff like that.
Yeah, I was gonna note that too. Just any organizations that may be interested in partnering and like hosting a watch party or thinking about questions in advance. So you've got a built-in audience with partnerships, whether on either platform or all platforms. So you've got like a group of people who have agreed to participate together.
Right. Okay. Alana, you're on mute.
No, I am.
Yeah.
No, I just stopped myself from talking. I was on like fake mute.
Yeah, okay.
No, I was just thinking about, I mean, I can talk with Femi about this, but just like, on Facebook, how does it work if we partner with someone on Facebook? That's really my question. Like, on Instagram, it's obviously really good to have, if we have someone like, by the way, I have to tell you about my conversation with Uzo Aduba's publicist, Uzo.
Okay.
But anyway, if we have someone like her, it's on Instagram Live, it makes sense to use her
Instagram Live.
Instagram too, but like, how does that work with Facebook? Do you know Femi or Kwabena?
Yeah, I know Facebook. I'm sorry. I was just going to say, I know Facebook has the Watch Together feature, and you can share it to a group. So any organization that has a presence on Facebook, their admins can tap into our video and share it to their group's page, and also invite people to have a watch party through the platform.
Okay.
Yeah, but Instagram does not. They've kept things really basic.
Mm.
Yeah.
Okay, so we have some things to work out then.
Okay, Kwabena, we can speak at our regular time to go into a more in-depth debrief.
Can I ask one other question?
Yeah.
So on the Instagram story, where you had the advertisement for this posted,
yeah,
it allowed you to swipe up, and it showed the Facebook live stream. Did someone add that? Once the problem happened?
Mo did that probably because he saw that we were struggling with Instagram.
Okay, that was really smart move to allow people accessing through Instagram to still get to it.
Yeah. That was Mo. Actually, I think Mo sent some Slack messages about that.
Okay.
Maybe. Am I imagining that? I can post 1 or 2 segments of the live talk to IG over the course of the week as well. I added a swipe up to IG to the live talk on Facebook.
The swipe up. That was really, really, really smart.
Yeah, yeah.
What I love.
It takes a team, man. I'm glad that all of us were on this call. This is also, for me, this is one of the learnings is it's good to have Kwabena. We are only doing programs when you are available.
I love Black people, y'all.
Anyway, okay.
All right, guys.
Thank you, everyone. Have a good evening.
Have a good evening,
Thank
everybody.
you. Good night, guys.
Bye-bye.
Great job.
Thanks. Bye-bye.